Welcome. In this Nclex dosage calculations challenge, you'll work through 50 of the most difficult calculation questions that commonly trip up nursing students. Take your time, solve each problem before looking at the answer, and use the rationales to strengthen your clinical judgment and calculation skills. Let's get started. Question 1. A healthcare provider prescribes cefazolin 1.5 g for every 8 hours for a client with cellulitis. The medication vial is labeled 500 milligrams per vial. The nurse reconstitutes each vial according to the manufacturer's instructions to yield 500 milligrams in 2 milliliters. How many milliliters should the nurse prepare for one dose? A. 4 milliliters. B. 5 milliliters. C. 6 milliliters. D. 8 milliliters. Answer. C. 6 milliliters. Rationale. 1.5 g equals 1,500 milligrams. Each 500 milligrams equals 2 milliliters. 1,500 milligrams divided by 500 milligrams equals 3 vials. 3 by 2 milliliters equals 6 milliliters. Question 2. A child weighs 33 pounds and is prescribed amoxicillin 45 milligrams per kilogram per day (PO) divided equally every 12 hours. The suspension available is 400 milligrams per 5 milliliters. How many ml should the nurse administer per dose? A. 2.1 milliliters. B. 3.8 milliliters. C. 4.2 milliliters. D. 5.5 milliliters. Answer. C. 4.2 milliliters. Rationale. 33 pounds divided by 2.2 is equal to 15 kg. Daily dose. 45 times 15 is equal to 675 milligrams per day. Twice daily. 675 divided by 2 is equal to 337.5 mg/dose. 400 milligrams. 5 milliliters equals 337.5 milligrams. X equals open parenthesis 337.5 times 5 close parenthesis divided by 400 equals 4.2 milliliters. Question 3. The healthcare provider orders heparin 1,200 units/hour by continuous infusion. The pharmacy prepares 25,000 units in 500 milliliters D5W. At what rate should the nurse program the infusion pump? A. 20 milliliters per hour. B. 22 milliliters per hour. C. 24 milliliters per hour. D. 26 milliliters per hour. Answer. C. 24 milliliters per hour. Rationale. 25,000 units divided by 500 milliliters equals 50 units/ml. 1,200 divided by 50 is equal to 24 ml/hr. Question 4. A client weighing 80 kilograms is prescribed dopamine at 5 micrograms per kilogram per minute. The 4-bag contains 400 milligrams dopamine in 250 milliliters D5W. At what rate should the nurse set the infusion pump? A. 12 milliliters per hour. B. 15 milliliters per hour. C. 18 milliliters per hour. D. 20 milliliters per hour. Answer. B. 15 milliliters per hour. Rationale. Required dose. 5 times 80 is equal to 400 micrograms per minute. 400 times 60 is equal to 24,000 micrograms per hour. Equals 24 milligrams per hour. Concentration. 400 milligrams divided by 250 milliliters equals 1.6 milligrams per milliliter. 24 divided by 1.6 is equal to 15 ml/hr. Question 5. The provider prescribes digoxin 125 micrograms PO daily. Available medication, 0.25 milligrams tablet. How many tablets should the nurse administer? A. 1/4 tablet. B. 1/2 tablet. C. 1 tablet. D. 2 tablets. Answer. B. 1/2 tablet. Rationale. 0.25 milligrams equals 250 micrograms. 125 divided by 250 is equal to 0.5 tablet. Question 6. A client is prescribed 1 L of normal saline over 8 hours using an infusion pump. At what rate should the nurse set the pump? A. 100 milliliters per hour. B. 115 milliliters per hour. C. 125 milliliters per hour. D. 150 milliliters per hour. Answer. C. 125 milliliters per hour. Rationale. 1,000 milliliters divided by 8 hours equals 125 milliliters per hour. Question 7. A provider prescribes acetaminophen 650 milligrams PO. Available tablets are 325 milligrams each. How many tablets should the nurse administer? A. 1 tablet. B. 1 1/2 tablets. C. 2 tablets. D. 3 tablets. Answer. C. 2 tablets. Rationale. 650 divided by 325 is equal to 2 tablets. Question 8. A client weighing 70 kilograms is prescribed enoxaparin 1 milligram per kilogram subcutaneously every 12 hours. The syringe available contains 80 milligrams per 0.8 milliliters. How many milliliters should the nurse administer? A. 0.5 milliliters. B. 0.6 milliliters. C. 0.7 milliliters. D. 0.8 milliliters. Answer. C. 0.7 milliliters. Rationale. Dose needed equals 70 milligrams. 80 milligrams equals 0.8 milliliters. 70 milligrams times 0.8 divided by 80 is equal to 0.7 ml. Question 9. A provider orders regular insulin 8 units subcutaneously. The vial is labeled U100 insulin. How many milliliters should the nurse draw up? A. 0.04 milliliters. B. 0.06 milliliters. C. 0.08 milliliters. D. 0.10 milliliters. Answer. C. 0.08 milliliters. Rationale. U100 insulin equals 100 units /ml. 8 divided by 100 is equal to 0.08 ml. Question 10. A healthcare provider prescribes vancomycin 1.25 g4. The pharmacy supplies 1 g/200 ml premixed bags and instructs that an additional 250 milligrams in 50 milliliters should be infused immediately afterward to complete the prescribed dose. What is the total volume the nurse should administer? A. 200 milliliters. B. 225 milliliters. C. 250 milliliters. D. 300 milliliters. Answer. C. 250 milliliters. Rationale. 1 g equals 200 milliliters. 250 milligrams equals 50 milliliters. Total volume equals 250 milliliters, which delivers the prescribed 1.25 g. Question 11. A healthcare provider prescribes gentamicin 5 milligrams per kilogram per day, 4 divided into 2 equal doses for a client weighing 80 kilograms. The pharmacy supplies gentamicin 80 milligrams per 2 milliliters. How many milliliters should the nurse administer per dose? A. 4 milliliters. B. 5 milliliters. C. 6 milliliters. D. 8 milliliters. Answer. B. 5 milliliters. Rationale. Calculate the total daily dose. 5 milligrams times 80 kilograms equals 400 milligrams per day. Divide into 2 equal doses. 400 milligrams divided by 2 is equal to 200 mg per dose. Calculate the volume to administer. 80 milligrams equals 2 milliliters. 200 times 2 divided by 80 equals 5 milliliters. Therefore, the nurse should administer 5 milliliters. Question 12. A client is prescribed 1,500 milliliters of lactated Ringer's solution over 10 hours using tubing with a drop factor of 15 GDT/ml. How many GDT/min should the nurse regulate? A. 35 GDT/min. B. 37 GDT/min. C. 38 GDT/min. D. 40 GDT/min. Answer. C. 38 GDT/min. Rationale. 1,500 times 15 divided by 600 is equal to 37.5. Round to the nearest whole number. 38 GDT/min. Question 13. A child weighs 24 kilograms. The prescribed dose of ceftriaxone is 75 milligrams per kilogram per day, 4 divided every 12 hours. The available medication contains 1 g in 10 milliliters after reconstitution. How many milliliters should the nurse administer per dose? A. 8 milliliters. B. 9 milliliters. C. 9.5 milliliters. D. 10 milliliters. Answer. B. 9 milliliters. Rationale. Daily dose. 75 times 24 is equal to 1,800 milligrams per day. Every 12 hours. 1,800 divided by 2 is equal to 900 mg. Concentration. 1,000 milligrams equals 10 milliliters. 900 times 10 divided by 1,000 is equal to 9 ml. Question 14. The healthcare provider prescribes nitroglycerin 15 micrograms per minute. The 4 solution contains 50 milligrams in 250 milliliters D5W. At what rate should the nurse set the infusion pump? A. For 0.5 milliliters per hour. B. 5 milliliters per hour. C. 6 milliliters per hour. D. 7.5 milliliters per hour. Answer. A. For 0.5 milliliters per hour. Rationale. 15 micrograms per minute times 60 is equal to 900 mg/hr. 900 micrograms equals 0.9 milligrams per hour. Concentration. 50 milligrams divided by 250 is equal to 0.2 mg/ml. 0.9 divided by 0.2 is equal to 4.5 ml/hr. Question 15. A provider prescribes phenytoin 300 milligrams PO daily. Available capsules contain 100 milligrams each. How many capsules should the nurse administer? A. 2. B. 2.5. C. 3. D. 4. Answer. C. 3. Rationale. 300 divided by 100 is equal to 3 capsules. Question 16. A patient weighing 154 pounds is prescribed enoxaparin 1.5 milligrams per kilogram once daily. The available syringe contains 150 milligrams per milliliter. How many milliliters should the nurse administer? A. 0.6 milliliters. B. 0.7 milliliters. C. 0.8 milliliters. D. 0.9 milliliters. Answer. B. 0.7 milliliters. Rationale. 154 pounds divided by 2.2 is equal to 70 kg. Dose. 70 times 1.5 is equal to 105 milligrams. 105 divided by 150 is equal to 0.7 ml. Question 17. The healthcare provider orders dopamine 10 micrograms per kilogram per minute for a client weighing 90 kilograms. The 4-bag contains 400 milligrams in 250 milliliters. At what rate should the nurse program the infusion pump? A. 30 milliliters per hour. B. 33.8 milliliters per hour. C. 35 milliliters per hour. D. 37.5 milliliters per hour. Answer. B. 33.8 milliliters per hour. Rationale. 10 times 90 is equal to 900 micrograms per minute. 900 times 60 is equal to 54,000 micrograms per hour. Equals 54 milligrams per hour. Concentration. 400 divided by 250 is equal to 1.6 mg/ml. 54 divided by 1.6 is equal to 33.75 ml/hr. Rounded. 33.8 milliliters per hour. Question 18. The provider orders ampicillin 750 milligrams for. The medication is supplied as 1g reconstituted to 5 milliliters. How many milliliters should the nurse administer? A. 3.5 milliliters. B. 3.75 milliliters. C. For milliliters. D. For 0.25 milliliters. Answer. B. 3.75 milliliters. Rationale. 750 by 5 divided by 1,000 equals 3.75 milliliters. Question 19. A child weighs 18 kilograms. The safe dosage range for a medication is 20 to 40 mg/kg/day divided every 8 hours. The provider prescribes 300 milligrams every 8 hours. Which nursing action is appropriate? A. Administer the medication. B. Hold the medication because it exceeds the safe daily dose. C. Administer half the prescribed dose. D. Ask another nurse to verify and administer. Answer. B. Hold the medication because it exceeds the safe daily dose. Rationale. Safe daily range. 20 times 18 is equal to 360 milligrams per day. 40 times 18 is equal to 720 milligrams per day. Ordered dose. 300 milligrams every 8 hours. Equals 900 milligrams per day. Because 900 milligrams per day exceeds the maximum safe dose of 720 milligrams per day, the nurse should hold the medication and notify the provider. Question 20. A provider prescribes regular insulin at 6 units/hour by continuous infusion. The pharmacy prepares 100 units of regular insulin in 100 milliliters of normal saline. At what rate should the nurse set the infusion pump? A. 4 milliliters per hour. B. 5 milliliters per hour. C. 6 milliliters per hour. D. 8 milliliters per hour. Answer. C. 6 milliliters per hour. Rationale. Concentration. 100 units divided by 100 milliliters equals 1 unit/ml. To deliver 6 units/hour, infuse 6 milliliters per hour. Question 21. A healthcare provider prescribes norepinephrine at 8 micrograms per minute for a client with septic shock. The 4 solution contains 8 milligrams of norepinephrine in 250 milliliters D5W. At what rate should the nurse set the infusion pump? A. 12.5 milliliters per hour. B. 15 milliliters per hour. C. 18 milliliters per hour. D. 20 milliliters per hour. Answer. B. 15 milliliters per hour. Rationale. Convert the concentration. 8 milligrams equals 8,000 micrograms. 8,000 micrograms divided by 250 milliliters equals 32 micrograms per milliliter. Required dose. 8 micrograms per minute times 60 is equal to 480 mcg/hr. Pump rate. 480 divided by 32 is equal to 15 ml/hr. Question 22. A child weighs 22 kilograms. The healthcare provider prescribes clindamycin 30 milligrams per kilogram per day, 4 divided every 8 hours. The medication available is 600 milligrams in 4 milliliters. How many milliliters should the nurse administer per dose? A. 1.2 milliliters. B. 1.4 milliliters. C. 1.5 milliliters. D. 1.8 milliliters. Answer C. 1.5 milliliters. Rationale. Daily dose. 30 times 22 is equal to 660 milligrams per day. Every 8 hours equals 3 doses/day. 660 divided by 3 is equal to 220 mg/dose. Concentration. 600 milligrams equals 4 milliliters. 220 times 4 divided by 600 is equal to 1.47 ml. Round to the nearest tenth. 1.5 milliliters. Question 23. The provider prescribes 1,800 milliliters of D5½ over 12 hours using tubing with a drop factor of 20 GDT/ml. How many drops per minute should the nurse regulate? A. 48 GDT/min. B. 50 GDT/min. C. 52 GDT/min. D. 55 GDT/min. Answer. B. 50 GDT/min. Rationale. 1,800 times 20 divided by 12 times 60 is equal to 36,000 divided by 720 is equal to 50 GDT/min. Question 24. A client weighing 60 kilograms is prescribed dobutamine 7.5 micrograms per kilogram per minute. The 4 solution contains 500 milligrams in 250 milliliters. At what rate should the infusion pump be set? A. 11.3 milliliters per hour. B. 12.5 milliliters per hour. C. 13.5 milliliters per hour. D. 15 milliliters per hour. Answer. C. 13.5 milliliters per hour. Rationale. Required dose. 7.5 times 60 is equal to 450 micrograms per minute. 450 times 60 is equal to 27,000 micrograms per hour. Equals 27 milligrams per hour. Concentration. 500 milligrams divided by 250 milliliters equals 2 milligrams per milliliter. 27 divided by 2 is equal to 13.5 ml/hr. Question 25. A provider orders methylprednisolone 125 milligrams for. The vial is labeled 500 milligrams, and after reconstitution it contains 8 milliliters. How many milliliters should the nurse administer? A. 1.5 milliliters. B. 2 milliliters. C. 2.5 milliliters. D. 3 milliliters. Answer. B. 2 milliliters. Rationale. 500 milligrams equals 8 milliliters. 125 times 8 divided by 500 is equal to 2 ml. Question 26. A client weighs 176 pounds. The healthcare provider prescribes vancomycin 15 milligrams per kilogram for every 12 hours. How many milligrams should the nurse administer per dose? A. 1,000 milligrams. B. 1,100 milligrams. C. 1,200 milligrams. D. 1,250 milligrams. Answer. C. 1,200 milligrams. Rationale. 176 pounds divided by 2.2 is equal to 80 kg. 15 times 80 is equal to 1,200 milligrams. Question 27. A medication order reads, morphine 4 milligrams for every 4 hours as needed for severe pain. The vial contains 10 milligrams per milliliter. How many milliliters should the nurse administer? A. 0.2 milliliters. B. 0.3 milliliters. C. 0.4 milliliters. D. 0.5 milliliters. Answer. C. 0.4 milliliters. Rationale. 4 divided by 10 is equal to 0.4 ml. Question 28. A provider prescribes 1 L of normal saline over 6 hours using tubing with a drop factor of 15 GDT/ml. How many drops per minute should the nurse regulate? A. 40 GDT/min. B. 41 GDT/min. C. 42 GDT/min. D. 45 GDT/min. Answer. C. 42 GDT/min. Rationale. 1,000 times 15 divided by 360 is equal to 41.7. Round to the nearest whole number. 42 GDT/min. Question 29. A child weighs 14 kilograms. The provider prescribes cefotaxime 600 milligrams for every 8 hours. The safe dosage range is 100 to 150 mg/kg/day divided every 8 hours. Which action should the nurse take? A. Administer the medication. B. Hold the medication because it is below the safe range. C. Hold the medication because it exceeds the safe range. D. Administer only half the dose. Answer. A. Administer the medication. Rationale. Safe daily range. Minimum. 100 times 14 is equal to 1,400 milligrams per day. Maximum. 150 times 14 is equal to 2,100 milligrams per day. Ordered. 600 milligrams every 8 hours. Equals 1,800 milligrams per day. Since 1,800 milligrams per day falls within the safe range, the nurse should administer the medication. Question 30. A client is receiving heparin 1,500 units/hour. The 4-bag contains 30,000 units in 500 milliliters. At what rate should the infusion pump be programmed? A. 20 milliliters per hour. B. 22.5 milliliters per hour. C. 25 milliliters per hour. D. 30 milliliters per hour. Answer. C. 25 milliliters per hour. Rationale. Concentration. 30,000 units divided by 500 milliliters equals 60 units/ml. Required rate. 1,500 divided by 60 is equal to 25 ml/hr. Question 31. A healthcare provider prescribes epinephrine at 0.05 micrograms per kilogram per minute for a client weighing 80 kilograms. The 4 solution contains 4 milligrams of epinephrine in 250 milliliters D5W. At what rate should the nurse set the infusion pump? A. 12 milliliters per hour. B. 15 milliliters per hour. C. 18.8 milliliters per hour. D. 20 milliliters per hour. Answer. B. 15 milliliters per hour. Rationale. Required dose. 0.05 micrograms times 80 kilograms equals 4 micrograms per minute. 4 micrograms per minute times 60 is equal to 240 mcg/hr. Concentration. 4 milligrams equals 4,000 micrograms. 4,000 micrograms divided by 250 milliliters equals 16 micrograms per milliliter. Pump rate. 240 divided by 16 is equal to 15 ml/hr. Question 32. A child weighs 30 kilograms. The The healthcare provider prescribes cefepime 150 milligrams per kilogram per day, 4 divided every 8 hours. The medication is available as 1g in 10 milliliters after reconstitution. How many milliliters should the nurse administer per dose? A. 13.5 milliliters. B. 15 milliliters. C. 16 milliliters. D. 18 milliliters. Answer: B. 15 milliliters. Rationale: daily dose. 150 times 30 is equal to 4,500 milligrams per day. 3 doses daily. 4,500 divided by 3 is equal to 1,500 mg/dose. Concentration: 1,000 milligrams equals 10 milliliters. 1,500 times 10 divided by 1,000 is equal to 15 ml. Question 33. A healthcare provider orders 2,400 milliliters of 4 fluids over 24 hours using tubing with a drop factor of 20 GDT/ml. How many drops per minute should the nurse regulate? A. 30 GDT/min. B. 32 GDT/min. C. 33 GDT/min. D. 35 GDT/min. Answer: C. 33 GDT/min. Rationale: 2,400 times 20 divided by 24 times 60 is equal to 48,000 divided by 1,440 is equal to 33.3. Round to the nearest whole number. 33 GDT/min. Question 34. A client weighing 75 kilograms is prescribed dopamine 8 micrograms per kilogram per minute. The 4-bag contains 800 milligrams in 500 milliliters. At what rate should the infusion pump be programmed? A. 20.5 milliliters per hour. B. 22.5 milliliters per hour. C. 24 milliliters per hour. D. 25 milliliters per hour. Answer: B. 22.5 milliliters per hour. Rationale: required dose. 8 times 75 is equal to 600 micrograms per minute. 600 times 60 is equal to 36,000 micrograms per hour. Equals 36 milligrams per hour. Concentration: 800 milligrams divided by 500 milliliters equals 1.6 milligrams per milliliter. Pump rate: 36 divided by 1.6 is equal to 22.5 ml/hr. Question 35. The healthcare provider prescribes furosemide 60 milligrams for. The medication available is 40 milligrams in 4 milliliters. How many milliliters should the nurse administer? A. 4 milliliters. B. 5 milliliters. C. 6 milliliters. D. 6.5 milliliters. Answer: C. 6 milliliters. Rationale: 40 milligrams equals 4 milliliters. 60 times 4 divided by 40 is equal to 6 ml. Question 36. A patient weighs 198 pounds. The provider prescribes gentamicin 2 milligrams per kilogram for. The medication available contains 40 milligrams per milliliter. How many milliliters should the nurse administer? A. 4 milliliters. B. 4.5 milliliters. C. 5 milliliters. D. 5.5 milliliters. Answer: B. 4.5 milliliters. Rationale: 198 pounds divided by 2.2 is equal to 90 kg. Required dose: 90 times 2 is equal to 180 milligrams. Volume: 180 divided by 40 is equal to 4.5 ml. Question 37. A healthcare provider prescribes regular insulin at 3 units/hour. The pharmacy prepares 50 units of regular insulin in 50 milliliters of normal saline. At what rate should the nurse set the infusion pump? A. 2 milliliters per hour. B. 3 milliliters per hour. C. 4 milliliters per hour. D. 5 milliliters per hour. Answer: B. 3 milliliters per hour. Rationale: concentration: 50 units divided by 50 milliliters equals 1 unit/ml. Required dose: 3 units/hour equals 3 milliliters per hour. Question 38. The provider orders phenytoin 250 milligrams for. The vial contains 500 milligrams in 10 milliliters. How many milliliters should the nurse administer? A. 4 milliliters. B. 4.5 milliliters. C. 5 milliliters. D. 5.5 milliliters. Answer: C. 5 milliliters. Rationale. 500 milligrams equals 10 milliliters. 250 times 10 divided by 500 is equal to 5 ml. Question 39. A child weighs 20 kilograms. The healthcare provider prescribes ampicillin 400 milligrams for every 6 hours. The safe dosage range is 100 to 200 mg/kg/day divided every 6 hours. Which nursing action is appropriate? A. Administer the medication. B. Hold the medication because the dose is below the safe range. C. Hold the medication because the dose exceeds the safe range. D. Administer half the prescribed dose. Answer. B. Hold the medication because the dose is below the safe range. Rationale. Safe daily dose. Minimum, 100 times 20 is equal to 2,000 milligrams per day. Maximum, 200 times 20 is equal to 4,000 milligrams per day. Ordered. 400 milligrams every 6 hours equals 1,600 milligrams per day. Since 1,600 milligrams per day is below the minimum safe therapeutic range, the prescribed dose should not be administered without clarification. Question 40. A healthcare provider prescribes lidocaine at 2 milligrams per minute. The 4 solution contains 2 g of lidocaine in 500 milliliters D5W. At what rate should the nurse set the infusion pump? A. 20 milliliters per hour. B. 25 milliliters per hour. C. 30 milliliters per hour. D. 35 milliliters per hour. Answer. C. 30 milliliters per hour. Rationale. Required dose. 2 milligrams per minute times 60 is equal to 120 mg/hr. Concentration. 2g equals 2,000 milligrams. 2,000 milligrams divided by 500 milliliters equals 4 milligrams per milliliter. Pump rate. 120 divided by 4 is equal to 30 ml/hr. Question 41. A healthcare provider prescribes dopamine 12 micrograms per kilogram per minute for a client weighing 70 kilograms. The 4-bag contains 400 milligrams of dopamine in 250 milliliters D5W. At what rate should the nurse set the infusion pump? A. 28.5 milliliters per hour. B. 31.5 milliliters per hour. C. 34.0 milliliters per hour. D. 36.5 milliliters per hour. Answer. B. 31.5 milliliters per hour. Rationale. Required dose. 12 micrograms times 70 kilograms equals 840 micrograms per minute. 840 micrograms per minute times 60 is equal to 50,400 mcg/hr. Equals 50.4 milligrams per hour. Concentration. 400 milligrams divided by 250 milliliters equals 1.6 milligrams per milliliter. Pump rate. 50.4 milligrams per hour divided by 1.6 milligrams per milliliter equals 31.5 milliliters per hour. Question 42. A child weighs 18 kilograms. The healthcare provider prescribes ceftriaxone 100 milligrams per kilogram per day, 4 divided every 12 hours. The medication is available as 2g reconstituted to 20 milliliters. How many milliliters should the nurse administer per dose? A. 8 milliliters. B. 9 milliliters. C. 9.5 milliliters. D. 10 milliliters. Answer. B. 9 milliliters. Rationale. Daily dose. 100 times 18 is equal to 1,800 milligrams per day. Every 12 hours. 1,800 divided by 2 is equal to 900 mg/dose. Concentration. 2,000 milligrams equals 20 milliliters. 900 times 20 divided by 2,000 is equal to 9 ml. Question 43. A provider orders 2,000 milliliters of 4 fluid over 16 hours using tubing with a drop factor of 15 GDT/ml. How many drops per minute should the nurse regulate? A. 30 GDT/min. B. 31 GDT/min. C. 32 GDT/min. D. 33 GDT/min. Answer. B. 31 GDT/min. Rationale. 2,000 times 15 divided by 16 times 60 is equal to 30,000 divided by 960 is equal to 31.25. Round to the nearest whole number. 31 GDT/min. Question 44. The healthcare provider prescribes norepinephrine 12 micrograms per minute. The 4 solution contains 16 milligrams in 250 milliliters D5W. At what rate should the nurse set the infusion pump? A. 10 milliliters per hour. B. 11.25 milliliters per hour. C. 12.5 milliliters per hour. D. 15 milliliters per hour. Answer. B. 11.25 milliliters per hour. Rationale. Required dose. 12 micrograms per minute times 60 is equal to 720 mcg/hr. Concentration. 16 milligrams equals 16,000 micrograms. 16,000 divided by 250 is equal to 64 mcg/ml. Pump rate. 720 divided by 64 is equal to 11.25 ml/hr. Question 45. A healthcare provider orders hydrocortisone 250 milligrams for. The vial contains 500 milligrams, which is reconstituted to a total volume of 10 milliliters. How many milliliters should the nurse administer? A. 2.5 milliliters. B. 4 milliliters. C. 5 milliliters. D. 6 milliliters. Answer. C. 5 milliliters. Rationale. 500 milligrams equals 10 milliliters. 250 times 10 divided by 500 is equal to 5 ml. Question 46. A patient weighs 110 pounds. The healthcare provider prescribes vancomycin 20 milligrams per kilogram for. How many milligrams should the nurse administer? A. 900 milligrams. B. 1,000 milligrams. C. 1,100 milligrams. D. 1,200 milligrams. Answer. B. 1,000 milligrams. Rationale. 110 pounds divided by 2.2 is equal to 50 kg. 20 times 50 is equal to 1,000 milligrams. Question 47. The provider prescribes regular insulin 18 units subcutaneously. The insulin available is U100. How many milliliters should the nurse administer? A. 0.16 milliliters. B. 0.18 milliliters. C. 0.20 milliliters. D. 0.22 milliliters. Answer. B. 0.18 milliliters. Rationale. U100 insulin equals 100 units/ml. 18 divided by 100 is equal to 0.18 ml. Question 48. A healthcare provider prescribes cefazolin 2G4. The medication is supplied as 1G reconstituted to 4 milliliters. How many milliliters should the nurse administer? A. 6 milliliters. B. 8 milliliters. C. 10 milliliters. D. 12 milliliters. Answer. B. 8 milliliters. Rationale. Each 1G equals 4 milliliters. For 2G, 2 times 4 is equal to 8 milliliters. Question 49. A child weighs 16 kilograms. The prescribed medication is 500 milligrams every 8 hours. The recommended safe dosage range is 60 to 90 mg/kg/day divided every 8 hours. Which nursing action is appropriate? A. Administer the medication. B. Hold the medication because the prescribed dose exceeds the safe daily range. C. Hold the medication because the prescribed dose is below the safe daily range. D. Administer half of the prescribed dose. Answer. B. Hold the medication because the prescribed dose exceeds the safe daily range. Rationale. Safe daily range. Minimum. 60 times 16 is equal to 960 milligrams per day. Maximum. 90 times 16 is equal to 1,440 milligrams per day. Ordered. 500 milligrams every 8 hours equals 1,500 milligrams per day. Because 1,500 milligrams per day exceeds the maximum safe daily dose of 1,440 milligrams per day, the nurse should hold the medication and notify the provider. Question 50. A healthcare provider prescribes heparin 1,800 units/hour by continuous 4 infusion. The pharmacy prepares 40,000 units of heparin in 1,000 milliliters of normal saline. At what rate should the nurse set the infusion pump? A. 40 milliliters per hour. B. 42 milliliters per hour. C. 45 milliliters per hour. D. 50 milliliters per hour. Answer. C. 45 milliliters per hour. Rationale. Concentration. 40,000 units divided by 1,000 milliliters equals 40 units/ml. Required infusion rate. 1,800 units/HR divided by 40 units/ml equals 45 milliliters per hour. Great work completing all 50 dosage calculation questions. Consistent practice is the key to mastering medication calculations and building confidence for the Nclex. Review any questions you missed, practice the formulas regularly, and keep sharpening your clinical reasoning. Thanks for studying with us, and we'll see you in the next Nclex Mastery session.